So I think I'm going to start with the introduction for Dr. Heather Kennedy, who's the Director of Feline Operations at the KC Pet Project, and she's going to talk about caring for feline leukemia positive cats. Heather is the Director of Feline Operations at KC Pet Project. Her role encompasses all aspects of feline operations, including animal care, health and enrichment, and behavior, and feline fostering. Her career helping cats started as an experienced cat trapper, colony caregiver, and foster caregiver. She went on to attend UC Davis School of Veterinary Medicine, where her singular commitment to cats earned her numerous scholarships, as well as the AAFP Outstanding Scholar Award. In 2017, after 4 years in the feline-only private practice, Heather decided to focus on the welfare of shelter cats. She's recognized as an expert on the humane care of feral cats and currently sits on the AAFP Committee on free-roaming cats and speaks at national conferences on her work in sheltering. She was mentored by Dr. Niels Pedersen, a nationally recognized expert on feline infectious peritonitis, and she often provides consults to other veterinarians on the diagnosis of the disease. She managed the Alley Cat Allies Emergency Shelter after Hurricane Katrina, was instrumental in helping Santa Barbara County, California, become no-kill through TNR and return to field. She started and managed a feral cat clinic in Yolo County, California, where she mentored students on TNR and the humane care of feral cats. So, Dr. Kennedy, I would like to welcome you, and I'm going to hand it over to you now.
So thank you very much for the introduction, and thank you for having me today. I've had the honor of presenting at this conference a couple of times now, and every time I hear that bio, that's the introduction, I keep thinking I need to whittle that down a little bit because that's a lot of stuff in there. Really, I think the thing that I'm trying to impart with my bio is that I'm not just a veterinarian. I have a lot of experience with cats outside of my experience in veterinary medicine. And so whenever I am imparting any information to you, it's not just from the perspective of a veterinarian, it's from the perspective of someone who is helping cats for a long time before she became a veterinarian. I'm currently at Kansas City Pet Project, and we are a large open admission shelter. And we're on track to probably take in, I don't know, I think we might get to 7,000 cats this year. Intakes are crazy this year, so we'll see how we come out, but we may very well be taking in 5,000 cats this year, or 7,000 cats this year. So we have a lot of cats come through, and some percentage of them, I'm not sure right now, we'll track this data at the end of the year, are going to be what I'm going to refer to as FeLVs, because that's Julie Levy's word for them, and I think it's convenient to say that as opposed to saying FeLV positive kitties all the time. So this presentation is about caring for FeLVs, and the presentation is going to be focused on the care of one particular FeLV that we had for about a year, Virgil Noir. So I'll introduce him, and we'll use him as our cat, our model cat for this presentation. So first, the elephant in the room is something that I'd like to talk about, is why one veterinarian says one thing and another veterinarian says another thing when it comes to FeLV, and how do you decide who to believe? And what I've decided is I'm going to talk about this after the PowerPoint when we start the question session, and I'm sharing my webcam again. Then we're going to talk a little bit about this because my friend Margaret Tompkins shares posts about FeLV positive cats on her Facebook page all the time, and it's a little surprising to people that some of the things she says that are more progressive about FeLV not being as contagious as we previously thought, and FeLV cats not needing to be euthanized. There's actually quite a lot of debate on her Facebook page when she posts anything like that, and it's because different organizations and individuals working with different vets get different information from their vets. And so it'd be nice if we all had the same information all the time, but we don't. And so at the end of the presentation, we're going to talk a little bit about that and what you can do about it. The key takeaways for my presentation are that how we treat FeLV cats is very important, both for the concern of the individual cat and for the concern of FeLV cats in general. And then how we talk about it to people matters. So how we talk about it to adopters, to other members of staff at the shelter, to friends, to people on our Facebook page. How we talk about FeLV makes a big difference in the potential outcomes of these cats. So this is Virgil Noir, a cat greeter and educator who lived at Kansas City Pet Project again for about a year. I don't think that, there we go. I don't think that there's actually a video there. So with our care and handling of FeLVs, we can model behavior that demonstrates that these kitties can have good lives and don't require much more care than any other kitty. First of all, we have to make a diagnosis, and this is the first controversial topic in FeLV. How do we actually make that diagnosis? And so we're looking at a positive IDEXX SNAP combo test. The combo test for IDEXX is an FeLV FIV test. And so this is positive for feline leukemia. There are different in-house tests, Witness, IDEXX. There are others I'm sure I'm not aware of. There have been studies that have resulted in the conclusion that the IDEXX in-house SNAP test is the most reliable of those tests. So number one, if you're working with an organization or with a vet that uses something other than the IDEXX SNAP test, then you might consider either changing if you have the ability to make the change, or asking your vet to order these other tests. And here at Kansas City Pet Project, we aren't testing for FIV routinely. We actually don't test for it at all. So we don't use the combo test. We use just the FeLV test. And if you are a shelter purchasing IDEXX SNAP tests, the combo test is about $7 more expensive than the FeLV test alone. So you can save your organization considerable money if you just make the switch to testing for FeLV only, if you choose to do that. So this is a positive SNAP test. And then the question is, what does that even mean? And we know now that SNAP tests can be positive at a point in time and negative later. So you may have a cat that tests positive today, that tests negative later because they've either beaten the disease or because they were stressed at the time of the test and had more antigen in their bloodstream and maybe have less later, or because you've simply had a false positive test. Screening tests are designed to make sure that we don't accidentally let any cats that might have FeLV slip through the cracks. So you are going to have some percentage of false positive tests. So remember that a positive test doesn't mean that this kitty will always have FeLV, has FeLV now even because it may be false positive, or doesn't give you any idea about the kitty's lifespan. A second test can be performed. At our shelter, we're doing a one and done. So we do the SNAP test, and if it's positive, we say this kitty currently is positive for FeLV. If it's negative, we say the kitty's currently negative for FeLV, but we stop testing then. But in the case of Virgil Noir, we did go ahead. He had other medical issues, and we were trying to decide whether we were going to have a good outcome for this guy. So we went ahead and did an FeLV quantitative PCR test through IDEXX. So the quantitative part is important because a PCR test can tell us, yes, for certain this test is right, this cat does have leukemia virus, but we need that quantitative PCR to tell us just how positive, just how much antigen, and just how much antibody this cat has for leukemia virus. So Virgil Noir in this case had a whole lot of FeLV antigen in his bloodstream. And so we considered him, based on his test result, to be a kitty with progressive FeLV, meaning that we consider that he will always have FeLV and will at some point succumb to the disease. So then the question is, how long can we expect our FeLV positive cat to live? And one of my favorite websites about FeLVs, is the San Francisco SPCA. So they say the most important thing here in the top line, which is, it is impossible to predict the lifespan of any cat regardless of their current health status. Such an important thing that everyone adopting a cat or owning a cat should understand is knowing FeLV status and knowing that Virgil has progressive FeLV. We can know generally what happens to cats. We know that generally cats with progressive FeLV may live only a few years beyond diagnosis, maybe less than that. But every cat's an individual, and it's impossible to predict what may happen regardless of current health status. So we tell people here at the shelter, we don't really know. We say that we would expect he won't live more than a few years, but he may die much sooner and he may live much longer. We honestly just don't know. One of the problems with determining how long an FeLV may live is that this isn't something that's been studied for years. Lifespan hasn't been studied for all that long, because in the past, cats that tested positive for leukemia virus were euthanized, and so we didn't track over a long period of time in large numbers how long those cats actually lived. So remember that we don't have a lot of data. Dr. Levy's been working with Austin Pets Alive to get data, because they're a large shelter that's adopting out of a lot of FeLVs, but we don't have decades of data to tell us how long they might live, because again, it was just common to euthanize FeLVs. So we've made our diagnosis, or we at least believe that today Virgil is FeLV positive. So what special care does this cat need? First of all, this is especially for people in shelter and rescue settings, there's no need to separate FeLVs from the general population if cats are kept in kennels. Just follow standard care guidelines. They don't need to be a certain number of feet away from other cats. Just separating them is fine. If you do allow free roaming, you shouldn't really allow FeLVs to roam freely with non-FeLVs. And now I'm talking about, again, the rescue or shelter population. So you don't want them to roam freely with non-FeLVs, because there could be disease transmission. We know that it's harder than we previously believed for disease to transmit from one kitty to another, but not impossible. And so if you're running a shelter or rescue, the best practice is to not let FeLVs and non-FeLVs mix together. And then when you do allow free roaming of FeLVs, or non-FeLVs for that matter, minimize the number of cats in each colony room so that you can have a healthy population. A healthy population is a low stress population, and so the fewer number of cats mingling together, typically the lower level of stress. This is something that I've seen at our shelter at one point, to be quite honest. A sign on a kennel that said FeLV positive, staff only, wear gloves. And you might notice down in the right hand corner of this kennel, there's even a padlock on this cage. So we were sending out a message that this is a terrible disease, highly contagious, and the wear gloves part, I'm not even sure of. I'm not sure if whoever hung this sign actually thought that it was transmissible to humans, or maybe they were thinking of protecting the cat with the weakened immune system. But this sends out the wrong message to people. Again, if this cat's in a kennel by himself, we don't really need special signing about staff only or wear gloves. We don't need a padlock. We should have a sign up to let people looking know that this is a FeLV, but it doesn't need to be communicated in a negative manner like it's a dangerous thing. Let's see how this is going to be so at our shelter, this is Virgil Noir. So Virgil would go on his walk of the cat adoption room every morning. He has skin issues, which is why we see him wearing his little e-collar to help him from scratching himself. So there's a little racetrack around the cat adoption room, and every morning Virgil would be allowed to walk around the cat adoption room and check out the other kitties. And this sent a message to anybody seeing that this cat is just like other cats. We're not going to let him into a kennel with another cat, but he can walk around our floors, and we aren't running around behind him with a bottle of rescue to clean up after him. He's not a danger to the cats around him. And then this is a sign that is a lot better than the previous yellow sign you saw. Adopt positive. I am an FeLV feline. It's a mouthful, I know, but basically it means that I am less able to defend myself against a wide range of infections. I would best live a healthy life as your one and only. So we're saying there that we're trying to de-escalate this virus. It's not a threat to most other kitties. And I think the blue tape, we used to adopt these kitties out for free. I'm not sure if we're doing that now. We may have covered that on the sign. And then I'd also kind of argue, honestly, with the I would best live a healthy life as your one and only. We can talk about that a little more in depth later on in the presentation. But while other cats may be more of a risk to Virgil because they may make him sick, he's not really much of a risk to a healthy adult cat. Actually providing care for cats in the shelter, any nutritionally complete diet is fine. We don't need to give them a special diet. We do want to weigh them weekly because the best and earliest indicator of ill health in a cat that anybody can see, whether or not they have a veterinary degree, is weight loss. Cats are on the internet a lot, but they don't really develop body image problems from being on the internet, and they don't try to lose weight. So any cat that's losing weight, unless we've done something to the diet to make that cat lose weight, that's a sign of some problem. And so I would advocate with all cats, you should have a toddler scale at home, in your shelter or rescue, and you should be weighing cats weekly, but especially with these guys, because we're going to want to note any sign of illness and work on them as quickly as possible to get it under control. Maybe the cat's not losing weight because it's not eating. Maybe it's just a matter of a different diet preference, but maybe it's also that the kitty's not feeling well. This is a $45 toddler scale from Amazon, and that is the one I use. And then in the shelter again, we've got a weight history. So this was Virgil Noir's weight history. He started out at 12.8 pounds. He lost a little bit of weight. He lost over a pound, and we noted that, and got him on a different diet that he preferred. And then he sort of started to become a little chunky, honestly. We also want to watch out, in addition to weight loss, we want to watch out for vomiting and diarrhea. Vomiting is never normal. And diarrhea is never normal either, but it's more common in general. When you think about your population at a rescue shelter or even in your foster home, you'll see diarrhea much more commonly than vomiting. Diarrhea can be the result of stress, food change. It can be even if you aren't feeding a completely consistent diet, like if you change protein sources. So you'll feed salmon one day and turkey and giblets another. So diarrhea can be caused by any of those things. And of course, it can be caused by easily treated parasites. It's not normal, but it's common, and it's not always a sign of illness. Whereas vomiting is really never normal, and that's pretty much always a sign of some illness, unless you just dewormed a cat and they're vomiting because we've just killed some roundworms. Really, vomiting shouldn't happen. And I know people say, oh, it's a cat, it vomits. Think back to when you had a young cat. That cat probably never vomited, but then once cats get older, they start vomiting, and we kind of start to see it as a routine thing. There's something going on with the GI tract or outside of the GI tract, and in FeLVs especially, we want to always follow up on vomiting, because with FeLVs, one of the things that happens to them that leads to an earlier demise is that they will develop cancer. FeLVs are 62 times more likely to develop cancer than non-FeLVs. And so GI lymphoma is a common cancer in kitties. And whenever there's vomiting, we want to get an exam and make sure there's no evidence that we're developing GI lymphoma. So we're going to watch for decreased appetite, lethargy, and for lumps and bumps. Again, any of these things can be a sign of cancer. This is one of Virgil Noir's birthday parties.
Hey, Virgil is eating his birthday.
Virgil was very well loved, as you can see. That's one of his favorite volunteers who made him a birthday cake out of cat food. So FeLVs would benefit from more frequent visits to a veterinarian if they're amenable to it. Again, because veterinarians are trained to do exams on cats and can feel abnormal lymph nodes in the abdomen, or do the kidneys feel abnormal, which can happen with renal lymphoma. They're just more veterinarians are just trained to look out for more subtle signs of illness. And so to keep your FeLVs happy, you want your shelter vet to be looking at those kitties more often, or if you're with a rescue or foster-based organization, or if you just have your own FeLV, you want to have your vet checking out that kitty a little more often than you would normally take your own cat, your own healthy non-FeLV to the vet. So this is Virgil. He used to like to ride around the shelter in a stroller to see his fans. He loves it, and you can hear everybody loves Virgil. So this is just demonstrating again how we, and that's actually a member of our canine care team, if I recall correctly. This is just a demonstration of the fact that how we present our FeLVs to the public shapes how people see the virus. So if we de-escalate it and don't treat Virgil like he's a little bomb, then people are more receptive to learning more about FeLV and maybe adopting those kitties. So they should have, again, routine visits to a veterinarian to be examined for large lymph nodes, abnormal breathing pattern, large kidneys, poor body condition, abnormal abdominal palpation, and periodontal disease or stomatitis. These are all things that are indications that we may have a kitty that's developing cancer, or that we have a kitty with other disease that needs to be treated so that we can give them a better quality of life. Kitties with feline leukemia virus, they should actually be vaccinated against panleukopenia with a modified live vaccine, because we want them to be protected against panleukopenia, most importantly in that vaccine. The other viruses covered in that vaccine are herpes virus, which it doesn't offer complete protective coverage, but it can help minimize severity and duration of herpes virus flare-ups. And the other thing in that vaccine is Calicium virus, and that can be devastating to kitties. So even though they do have an immune compromise, we do want them vaccinated, and we want them vaccinated with a modified live vaccine, because that's the vaccine that's most likely to confer protective immunity against panleukopenia. Now, this is for shelters, rescues, foster homes, multi-cat homes. If you have your own FeLV, that's an only cat in your own home, then you should talk to your own vet about vaccination. Maybe in that much lower risk situation, you don't need to do this, but certainly in any multi-cat environment, I would recommend, this is the vaccine I would recommend. If you're at a shelter and in control of vaccines, please make sure those vaccines stay cold. We also want to treat these kitties for intestinal parasites and ectoparasites like fleas, because we want to make sure, number one, fleas can carry, although there's new research to indicate it may not be caused by fleas, but fleas can carry bloodborne parasites that result in anemia. And we don't want that to further hinder the health of a FeLV. And we also don't want them to have intestinal parasites that are leaching nutrients from their bodies. Our favorites here are Revolution, Revolution Plus, and Advantage Multi, because they deworm and provide flea treatment, and in some of these cases, tick treatment as well. We also want to make sure that if our FeLV gets an upper respiratory infection, that they get treated. So with many kitties in the shelter environment, just like humans with a cold, I'll just wait. So if a kitty gets signs of a viral respiratory infection, I won't do any treatment. We'll just wait to see if the kitty gets over it on its own. If it's a FeLV, I'm going to be more likely to start an antiviral medication, or if there's evidence of a bacterial infection, then an antibiotic. So for viral infection where there's clear discharge and where normally I wouldn't treat a non-FeLV, for FeLVs, I'm going to give them famciclovir at 90 mg per kg every 12 hours. I'm going to get as close to possible as 90 mg per kg. So I may not be able to get that high given how large those tablets are, but that's what we're shooting for. And then if there's evidence of bacterial infection, that's where we have green snot or yellow discharge, then we're going to start them on doxycycline. And I typically prefer to use compounded tablets because they're nice and small. I use Wedgwood mini tabs in 25 milligram strength. So again, if there's green snot from a kitty in the shelter, sometimes even those I'll wait to see if they overcome it. But for a FeLV, I'm always going to get them started right away on antibiotics. And then for cats, you can actually buy empty capsules that you can put tablets into to make them easier to swallow. So I like to coat everything in butter, and I always prefer tablets to suspensions or solutions, because suspensions and solutions are always going to wind up on the tongue and are always going to be bitter to some degree. Tablets, if you get them way to the back of the tongue, there aren't taste buds back there, so that's more pleasant for most kitties. If you give a tablet coated in butter, or if you give a tablet inside a capsule coated in butter, then cats really don't object to that at all. We're going to do routine blood work on our FeLVs. They do often develop anemia, and we were just talking about bloodborne parasites. Mycoplasma haemophilus is the one that I'm most interested in. And again, previously believed to have been carried by fleas, though there's some research to show that may not be the case. So know that there's research going on about this, but this bacteria attacks the red blood cells and can exacerbate anemia, and it can easily be treated with doxycycline or Veriflox. We really don't want these kitties to become antibiotic resistant. We don't want antibiotic resistance in general, but specifically for FeLVs. So if I think that a kitty might have mycoplasma contributing to their anemia, then I will actually look for those parasites on a blood smear, or there's testing that can be done through IDEXX, and I imagine through other labs. We just happen to use IDEXX. And everything I've just said also applies equally to every cat. So although all of this is much more important for FeLV, everything I've just said applies to any cat, because FeLVs are just like every other cat. Oops, sorry, I skipped a slide. So how we treat FeLVs matters. With our care and handling of FeLVs, we can model behavior that demonstrates that these kitties can have good homes and don't require really much more care than any other kitty. We just want to be a little more alert for problems, but they don't necessarily need different or more care. And as advocates of FeLV positive cats, we should frame the conversation in a way that de-escalates and educates. So we always want to be calm when discussing it and not sound like this is the end of the world when we see an FeLV diagnosis. Virgil. So Virgil did live with us again for about a year, and he was finally adopted. He had other problems in addition to feline leukemia. He also had skin issues. He would continually get wounds on his skin, and we finally isolated that to a probable dietary allergy. So he had to be on then special Royal Canin rabbit and pea food. But we did our best to market him like he'd wear costumes around the shelter. He's got a little friend down here in a rocket costume. And we'd post about Virgil a lot. And Virgil did ultimately get adopted. You can see here in this post, it was his 3rd birthday, and it was also his 1-year birthday of being in the shelter. And we said he most likely doesn't have a very long life ahead of him, and so we really wanted to get him into a home. And this was over a year ago that we posted this. Virgil had his own catio and would greet people who came to the shelter. His catio overlooked the parking lot and the entry to the building. So we did our best to costume this little guy and market him. Another post about Virgil, just seeing who might want to adopt this little guy. He became quite famous, and he did finally get adopted, and we've just gotten an update from his family over a year later, and he's still wearing this little cone. He doesn't really need it anymore. He doesn't have itchy skin. He's just used to wearing costumes now, so Virgil is always costumed and doing well. So how we talk about FeLV really matters. If an adopter is interested in adopting a FeLV into a home with other cats, we need to provide information on risk and advise about vaccination for the kitty that does not have FeLV, but we aren't the FeLV police. And I'm sure there are a lot of times where we're adopting kitties into homes where kitties already have FeLV, and we don't even realize it because most people don't really follow up on FeLV testing for their cats. They adopt a cat that's been tested, but I can tell you from being in private practice, often aren't recommending routine FeLV testing after that first test. So there may be cats out there that already have FeLV that are living in homes, and we're adopting cats into homes with those kitties without even realizing it. So we shouldn't really try to be the FeLV police. Number one, because we truly don't know the FeLV status of cats already in adoptive homes. And number two, because we already know that the test is a point in time, and unless we've done follow-up PCR testing, we don't truly know a kitty's ongoing FeLV status. Again, from the San Francisco SPCA website, another great page. Can an FeLV positive cat live with other cats? It is the sole responsibility of the adopter guardian to make the decision to house an FeLV positive cat with an FeLV negative cat. So that's it. It's the adopter's decision. We provide information, but we don't prohibit them from doing it. And we advise, but we don't prohibit. And again, it's impossible to predict the lifespan of any cat regardless of their current health status. So how we treat FeLVs and how we talk about them affects how others see them. And so we should be very cognizant that we should treat them just as we would any other cat, maybe being a little more alert again for any signs of illness, but we shouldn't be treating them differently from other cats. And we shouldn't talk about them in a way that makes a FeLV sound like something that's terribly negative. Because moving them out of the shelters and rescues and multi-cat environments and into homes of their own is the single most important thing we can do, both to save their lives, to give them a good quality of life, and to ensure their ongoing health. And that's the end of our story about Virgil. Again, he was adopted. He's a progressive FeLV kitty who lived with us for a year, was adopted over a year ago, and is still doing great in his adoptive home. I do want to take a few minutes to talk about the slide. Why are veterinarians so divided on this? Why do we not all have the same information? So what I want to say is that there's a lot to know in veterinary medicine. We've got a lot of species and a lot of things to know about a lot of species, and we're not all interested in the same thing. And so I'm particularly interested in FeLV. Julie Levy's interested in FeLV. So we're going to spend more time learning about it and making sure we're up to date on everything regarding FeLV. But not every vet is like that, because if you're a private practitioner and you're seeing dogs, cats, pocket pets, even if you're just seeing dogs and cats, a small percentage of your business is cats. Cats go to the vet far less often than dogs do, and fewer cats ever go to the vet. And so when you do see cats, it's a very small percentage, like 3% of the population that actually has FeLV. So a very small percentage of cats that come into your practice are ever going to test positive. And so you don't really feel like you need to stay up to date on everything regarding FeLV testing, because you just don't see that very often. So the problem is that we don't all know the same things. We don't all need to know the same things, but it would be nice if we disseminate this information about newer research into feline leukemia virus, and that it doesn't transmit easily to an adult cat that's over 3 years of age. It's pretty difficult for cats over 3 years of age to actually get FeLV virus. And then if those cats are living with an FeLV cat, and if they are vaccinated, that further decreases their chance of becoming infected. And these cats can live a long time. So if this information, if we were able to get this out to all of the vets, that'd be great, but it's just slow going because there's a lot to learn, a lot to stay on top of. And again, it's not something that private practitioners deal with all that often.
Sounds like they need to listen to a podcast while they're sitting in the practice and doing their paperwork. They can listen to the podcast.
Yeah. That's the other thing. None of us are just sitting around twiddling our thumbs, I assure you.
No. But some do have like music in the background and that kind of thing.
That's a good point.
No, so that's why a podcast works, so that you can listen to the podcast while you're doing your doing. And then you go, wait a minute, what did they just say? And you'll want to go back 30 seconds and all that stuff. So, but anyway, no, great presentation, great point. Just from perspective standpoint, estimated numbers, what's the number of feline leukemia positive kitties that KC Pet Project adopts out on an annual basis?
I think we were at about 70 last year. And I don't know this year again, because I haven't checked to see how many have tested positive this year. I feel like we're seeing fewer positive cats come through this year though. But we just started, like, it's the beginning of summer, so we'll see. This is our busy cat intake season, so I don't have an estimate yet.
Yeah, well, I mean, if you say, 70 versus 7,000, it does show how little it's really seen in the overall population of things. So just, statistical point to sort of handle. We've got a couple of sort of medical technical questions in here, so I'm just going to read them, and then you can, so I think you referenced doxy, using doxy to treat. Just wanted to confirm, you said 25 milligrams 2 times a day. Is that what you said?
So for, I'm using mini tabs ordered from Wedgwood, and they come in a 25 milligram concentration. But what I'm dosing at is 10 milligrams per kilogram once a day. And I'm typically treating until signs resolve. So if it's a kitty with evidence of a bacterial URI, they're getting 10 mg per kg once a day for as long as symptoms are present. And the 25 milligram mini tabs, typically so I can't be exact with tablets, but typically what I'll do is half a tablet works for kitties that are like around a kg, so my 2-pound kitties, and then a full tablet for the adult cats.
All right. And it's doxycycline that you use, right?
Yeah, doxycycline is very effective against most of the things that will cause bacterial URI symptoms in kitties. And it does cause esophageal strictures as if it gets stuck in the esophagus. So it must be followed by food. So I'll always, if it's a kitty that's not eating, they don't get doxycycline, but if they're eating, they get doxycycline.
How does your team match make adopters to feline leukemia positive cats?
They're treated just like any other cat. So the matchmaking progresses based on personality of the cat. And then if there's a cat with feline leukemia virus that seems like it would otherwise be a good match, then they'll say, we have a kitty that would probably fit with you really well. And he does have feline leukemia virus. And then they just explain feline leukemia virus a little bit. And people seem undeterred, and we do be quite frank with people and say this kitty might not live very long, and still people say, okay, that's okay, he still needs to live somewhere. So it's very uncommon for someone to be deterred by that.
Excellent. One more, I've got some more questions in here. So here is, what is the testing protocol for young kittens coming into the shelter? What age do you test, and do you recommend retesting at a certain age?
So we don't test until they are in the clinic for surgery. So first of all, I believe in fear-free handling as much as possible for cats in the shelter, and so we aren't taking our little 1-pound kittens that show up and trying to draw blood from them at intake. They're moving to foster homes with unknown viral statuses, and then they get tested when they come back in for surgery, and they're tested under anesthesia, again, to minimize fear, anxiety, and stress. And then it's a one and done. So they're either positive or they're negative, and we just relay to people tested negative at this time. We don't make any commitment to the fact that the kitty will always be negative or will always be positive. And then it's up to the adopter. So part of the American Association of Feline Practitioners guidelines on retroviral testing are that once a cat moves into a family home and is presented to a private practice veterinarian, then those private practice veterinarians have guidelines that the AAFP puts out on testing, and they recommend if a kitty was just adopted that the kitty gets retested. So it's possible that the adopter's vet will recommend retesting, but we're one and done at the shelter. And then there are cases like Virgil's where I'm curious and I'll do PCR testing. Like I had 2 kitties recently that came from the same home. They were both adults, and one tested positive on a SNAP test and one tested negative. And I was just curious to see if that was a real finding, and so we did follow-up PCR testing on the positive kitty, and that came back negative. So presumably that was a false positive test for that kitty.
I'm going to read this question here from Pamela. She says, thank you. If I hadn't saw your conference last year and listened to a specialty vet, we would have rehomed our feline leukemia positive as we had a negative at home. Our FeLuke positive is now 2 and asymptomatic, progressive by an IFA test. I have a great vet now who does blood work twice a year, and only abnormal result was low globulin. My vet thought this wasn't concerning, but wasn't sure if this is usual for a feline leukemia positive kitty. Thank you.
No, that's not usual. That's interesting. Not terribly concerning to me, but interesting. Normally when kitties have any kind of inflammation or cancer, the globulin goes up. So it seems to me like it's probably a good thing that the globulin's low, but that's kind of odd. It's not a typical finding, but great. I can't think of any reason for that to be a bad finding.
Is it true you're recommending a live FERCP vaccine over dead?
It is true. Again, I'm talking about shelter, rescue, and multi-cat settings, just because it would be devastating for a kitty with leukemia virus to be exposed to panleukopenia. And actually calicivirus is pretty terrible too. So I really want the most effective vaccine and the most rapidly effective vaccine. And those vaccines start conferring some level of immunity almost immediately, and in cats can be fully protective in 3 to 5 days. I don't know if there's a difference in FeLV kitties, if maybe it takes a little bit longer, because I don't think that specific use has been studied. But the problem with killed vaccines is they have to be boosted. They take longer to work. So if it's a kitty that's just owned by an individual in a home, then fine, use whatever vaccine your vet recommends. But in kitties in multi-cat environments, it's imperative that we get panleuk protection on board as quickly as possible.
So let's talk a little bit about the outdoor kitties, community cats, and feline leukemia. So I don't want to put words in your mouth. So what are your thoughts about testing cats that are going to be returned back to the colony?
They should not be tested. And in fact, if we have caregivers ask us to test, we do not do that. And I explained to them that this test, again, it's a screening test. So there are going to be false positives. And we would hate to have a kitty's life determined by a possible false positive. And if the kitty does come in with FeLV and it otherwise appears healthy, we're not going to euthanize based on that test result anyway. We're going to put him back in the community, and he's going back to the community where he would have, if he is FeLV positive, it's the community where he was exposed to FeLV. And so it's just not beneficial for me to know a possibly wrong test result for a kitty that really the best thing for that kitty is to get them in the shelter and back out as quickly as possible, again, to decrease their stress. Stress increases the perception of pain, so I want them back out in the community where they're not stressed, healing from the surgery they had. There's no benefit to testing community cats, and again, we just tell caregivers if they request it, no, we would only perform that test if we were considering euthanasia for a cat that didn't look good and we just wanted one more piece of data.
Right. I agree with you 100% from that standpoint. And then I have a question about kittens. So I think we spoke at last year's conference and just want to confirm that this is still the case. There's been some thoughts that waiting till the kittens are more like 5 or 6 months for cats with feline leukemia might be a better time for their spay neuter.
Let's see. I'm trying to think of what context we might have said that in.
Austin cats, I guess there was some talking about that they did better with surgery when they were a little bit bigger.
I think that good body condition is the most important thing. We'll still do surgery in very young kittens, but body condition is the most important thing for us to go by regardless of age. So a perfect body condition in a kitten means it's an okay time for surgery. In California, it's not uncommon now for kitties to be altered at 1.5 pounds, which tends to be about 6 weeks of age, but maybe a little bit older, as long as they're in good body condition. And they find that, those kitties get adopted more quickly because everybody wants small, cute kittens. And in addition to that, they're then socialized. So they're still in their sensitive period. So the sensitive period for kittens to socialize to humans is 2 to 7 weeks of age. So if you get them spayed or altered really early and get them into their new home, they're going to socialize to that home better. They're going to acclimate more easily. So I'm not a fan of waiting. I want kittens to have a good body condition when they have surgery, but I don't like the idea of waiting. If that's working for them, great, but that's not something that I would say would be a universal recommendation.
Going back to the colony management for a minute, one of the things that I get from people when they are advocating for testing is they say, well, but what if they get released and they're positive? I don't want them to have a miserable death out there. I know what my response would be for that, but how would you respond to that type of statement?
So again, the result of an FeLV SNAP test in an otherwise apparently healthy individual is as likely to be incorrect as it is to be correct. So I could basically flip a coin and guess right as to whether a kitty actually has FeLV or not. The positive predictive value in that test in apparently healthy animals is not good. So I would just be basically flipping a coin and deciding who's going to live and who's going to die. And then let's say that it actually is a positive test result and the kitty does go out there with FeLV. It may overcome the virus, number one, or yes, it may succumb to the virus at some point, but I've just made the kitty as healthy as I can make it now by giving it a dewormer, giving it a vaccine, desexing, and so now I'm giving it its best chance at a good life. And ultimately, all of these kitties outdoors are going to die in some way that we can't predict. And I don't know that dying of FeLV is any more, any worse than any other manner in which an animal dies. So No, thank you. I don't want that. I don't want to. I would much prefer to err on the side of sending a kitty out that might become sick and die in the near future than killing kitties that are healthy.
And I also just always add in, there's plenty of other conditions out there that, hate to say it, but have more suffering to that process for them than the end of life for a feline leukemia positive kitty. So, you know, it's just a lot. It's this little snapshot in time, and it doesn't mean anything for next week or next month or next year. And so we just have to make a choice at that point in time. I think we've got one more question here for you. It says here, can you speak about positive moms and how they can affect kittens? We get positive moms and the babies test negative or positive at 3 to 4 months. Should we recommend more testing by the adopter at 6 months or 1 year, or just let it be?
So again, we're putting, so we're relying on private practice vets to educate their clients and to recommend follow-up testing. And so for us, it's still a one and done. But it's reasonable to make a note in the record that the kitty was exposed to FeLV and had an FeLV positive mom, and then let the private practitioner determine or educate about whether or not to retest. But for us, it's one and done, regardless.
If a mom cat tests negative, do you have to test each kitten?
Oh, we test every individual period, yeah. And yes, we do find often that parts of a litter are positive and parts are negative, and we just adopt those out as positive and negative, because again, you should just think of this test as this point in time, and all you know is right now at this point in time. You should not make any other commitments to anyone about the viral status of a cat based off of that test.
Right, exactly. Sounds great. All right, well, Dr. Kennedy, I want to thank you so very, very much for joining us today, taking away from, go back, spay, neuter as many as you can. I know we have a veterinary shortage out there, so we don't want you away from the table as much. We want to make sure we maximize all the time. So I appreciate you taking the time to join us today, to be with us. Good luck with everything. Thank you for everything that you do, your veterinarians, your technicians, your team, the world's team. We appreciate all the work that everybody's doing to try and help animals in the community during this it's a very stressful time, for sure. So